It might be that time of year that your allergies are starting to act up. I know mine have been. But then you can't help but wonder if it's actually allergies or something worse. We always have to wonder if it's allergies or the flu. This year we have to wonder if it's allergies or the flu or COVID-19. So we're going to look into some of the symptoms and try to break them apart. We'll start with allergies. You'll typically have issues related to your sinuses or your eyes with allergies. You get those itchy and watery eyes. You'll probably also sneeze with allergies. Now, the flu and COVID are not as easy to tell apart. In both, you might have body aches, chills, fever, nausea, vomiting, or diarrhea. What's tough is the overlap with all three, which is a runny nose, congestion, sinus pressure, headaches, sore throat, or shortness of breath, which can come from any of them. Doctors say that shortness of breath or trouble breathing or eating is when you should get medical help, regardless of which it is.
To the point where you just can't keep any fluids or food in you, and then you're going to start to get really dehydrated, really weak. I think that's when you need to seek medical attention.
Now, one way you can tell the flu apart from COVID-19 is people with the flu typically feel sickest during the first week they're sick. With COVID, people may feel worse during the second or third week. They can also be sick for a longer time with COVID. The flu has a shorter incubation period. So that means after infection, it can take 1 to 4 days to feel sick, compared to the coronavirus, which can take 2 days to 2 weeks from infection to symptoms. One other thing that's unique to COVID is losing your taste and smell, which can sometimes happen. COVID-19 has actually killed more people in the last 8 months than the flu killed in 5 years. According to the CDC, from 2015 to 2020, 178,165 Americans died because of the flu. But according to Johns Hopkins, from February to September, 206,932 people in the U.S. died from COVID-19. A new study says the coronavirus can live on human skin for as long as 9 hours. That's a lot longer than the influenza virus, which can survive on skin for 2 hours. Researchers at a university in Japan were behind the study that found this. And the big takeaway is something that we've been saying since the start, which is just that washing your hands a lot is crucial to stop the spread of this virus.